for me, the data is one of those things that, to me, actually leads to a bit of mistrust. So again, from experience during the COVID times when we had to appear on radio and TV and so on, and one of the things is that people want to know, will this thing affect me? So it goes very quickly to how can you translate those numbers into my personal space? And if there's any kind of hesitation by the profession, it's like, you see, you don't know. So you are just throwing numbers at me, but you really don't know. So I can as well ask the next person. So there's a bit about health professionals as well being able to translate the data. And then I think one of the challenges health professionals, now the health system has, is that there's also that thing about branding. So the kind of people who come out as being branded, the people who are famous on TikTok or social media and all, some of them we don't like. So the true professional is supposed to be this really quiet fellow who sits in his lab coat, and you go to them and they dispense their wisdom. They don't go out promoting themselves. So and so you've got this problem of you want the data to speak, not the person. But in order to gain trust, you want the person to speak. So I think that's one of the challenges we have in terms of how to get this bit. So you'll have what Busi presented. It's okay in certain areas to present it, but when you're engaging the public, it's a challenge. Even for community health workers, if you're talking to them, and if you allow me, I'll just give an example from sort of my political side. Walking around in the village one day, one of my mobilizers, the husband, is a witch doctor. So there I was walking into the home and then finding all kinds of paraphernalia in the home. And this is the person you want to convince to take a vaccine, but clearly you can see they don't believe in that. So